Well, doctors are sounding the COVID alarm once again. Omicron is spreading rapidly here in Tennessee, leading to thousands of reported cases a day. Welcome to News 2 at 5. I'm Bob Mueller. Local health leaders say it's clear community spread has taken off in the volunteer state. News 2's Gerald Harris is live tonight with a look at the state of the virus in Tennessee. Gerald?
Yeah, Bob, it's very likely that as people go out into public, they will come in contact with someone who is COVID positive. Folks are lining up for many reasons to be tested for COVID.
After the holiday, I just feel like it's probably a good idea, especially if you're around family and things, and then I'm going out of town.
But the numbers don't look great. Tennesseans are returning positive tests around 22% of the time, leading to massive community spread.
When they're up to 19, 20, 25%, that's concerning. That means that a quarter or a fifth of all the people who are going to get tested are actually testing positive.
Tennessee averages nearly 4,000 daily cases.
There's also likely a large subset of people who are not getting tested, who are also infected with Omicron, either vaccinated people who are asymptomatic or mildly symptomatic. And so there's an additional burden of infection in the community.
With the high case counts, despite showing some evidence of milder illness with Omicron overall, the unvaccinated could be at risk of getting hospitalized.
So in general, the positive tests always happen early in the disease course. And we know that it takes a week or sometimes 2 weeks for you to get severely enough ill, if you're going to need the hospital.
Just 51% of Tennessee's population is vaccinated, leaving a void for COVID to intensely spread.
And some of our counties in Tennessee have vaccination rates as low as 30 or 35%. I mean, that means that 75% of the people in those counties who are at this moment highly susceptible to this, highly transmissible variant are also at risk for severe disease, which ultimately in some of those people leads to death.
And the Memphis region at this point is reporting its highest case count since its surge in September. The Nashville region is following very closely and could reach its peak sometime soon. Reporting in Nashville, Gerald Harris, News 2.